Welcome to another episode of the Bark Brigade podcast by Doggozila Magazine.
So glad to be here for this one.
Yeah, we have a really important mission today. I want you to imagine it's just a beautiful, sun-drenched Saturday afternoon.
The perfect weekend.
Right. And your dog just had the absolute time of their life swimming in the lake. I mean, they were launching off the dock, catching tennis balls, splashing around, just doing that vigorous full-body shake-off on the grass.
Oh, yeah, getting everybody totally soaked.
Exactly. And to you, everything seems perfect. So
Yeah.
you pack up the car, head home, give them dinner, and settle in for the evening.
Sounds like a pretty standard happy day.
But then it's maybe 3 or 4 hours later. The house is quiet, and your dog starts coughing.
And it's not a normal cough.
Right. It's persistent. It's not just like a polite throat clearing, but this harsh, grating hack. And you look over, and they seem unusually lethargic, just staring at you with this incredibly heavy, anxious look.
Which is terrifying.
It is. But the natural human instinct is to just write it off, right? You figure, oh, they're just completely wiped out from the sun. Or maybe they swallowed a weird bug, or they have a mild upset stomach from the lake water.
Which is such an easy assumption to make.
It really is.
Yeah.
But what if that delayed reaction is actually the start of a fatal countdown? Today, we are undertaking a massive, highly specialized deep dive into a phenomenon that just terrifies pet owners and veterinarians alike.
We're talking about dry drowning in dogs.
Yes, also known clinically as silent drowning. We are relying entirely on this incredibly detailed, comprehensive guide published by Doggozila Magazine to unpack the science, the deceptive timeline, and the life-saving protocols you really need to know when a fun swim turns into a silent crisis.
It really is the ultimate nightmare scenario for anyone who loves their dog. And the terror stems entirely from that delay you just described.
Because you think you're safe.
Exactly. As an owner, you assume you are safely out of the woods the second you towel them off and clip the leash back on.
Right. The dog is on dry land.
They're on dry land, they're breathing, the physical threat of drowning is geographically behind you. But with this specific phenomenon, leaving the water doesn't stop the clock. In fact, the biological clock might have, just started ticking.
Wow.
And the sheer lack of awareness surrounding how the body actually reacts to inhaled water means most owners just miss the critical window to intervene.
So let's start by completely dismantling the primary myth here. Because when I read the source material, the first thing that struck me was the naming convention itself.
The term dry drowning.
Yeah. It feels like an oxymoron. When we hear the word drowning, we immediately visualize the lungs acting like balloons, right? Like they fill up with gallons of water from a garden hose. We picture a dog totally submerged.
But that's not what's happening at all.
Right. The reality of dry drowning involves almost no water in the lungs whatsoever.
The term dry is actually aggressively literal in this medical context. If you were to look at the lungs of a dog experiencing this, they would be relatively dry.
That is so counterintuitive.
It really is. What is actually happening is a mechanical failure triggered by a microscopic amount of water. We're talking about a few stray drops.
Just a few drops.
Literally drops. When a dog is swimming or splashing or even just aggressively paddling, they take these rapid, open-mouth breaths. If a tiny droplet of water bypasses the mouth and hits the vocal cords, which is the larynx, it triggers a violent involuntary muscle spasm.
The laryngospasm.
Yes, the clinical term is a laryngospasm.
So the larynx just aggressively clamps the windpipe shut. I was trying to conceptualize this, and it feels like swallowing a tiny crumb of toast down the wrong pipe at breakfast.
That's a great analogy.
But instead of you just coughing it out for 10 seconds, getting teary-eyed, and going back to normal, your body's security system hits the ultimate emergency lockdown button. It barricades the front door and completely throws away the key.
Exactly.
You essentially trap everyone inside the building to save them from a threat that isn't really there.
The biological irony of that security system is just fascinating. I mean, evolutionary biology designed the larynx to act as the ultimate uncompromising bouncer for the lungs.
The bouncer.
Right, because the delicate alveolar sacs deep inside the lungs where the actual transfer of oxygen into the blood happens, they are incredibly fragile. Water destroys them.
So the body is just hyperprotective.
Hyperprotective. So the moment the sensory nerves in the larynx detect the chemical or physical presence of water, the brain sends an immediate, lightning-fast signal. Close the gate.
Bam. Shut down.
The muscles of the larynx contract completely, sealing off the trachea. Now, in a normal scenario, the dog swallows, the larynx relaxes, and they take a breath. But in dry drowning, the bouncer overreacts and refuses to open the door again.
So it just stays locked.
It locks in place, the tissue becomes irritated, the spasm holds, and the dog begins to suffocate on dry land because their own anatomy refuses to let air pass.
Which brings up a really important distinction, because I see owners online constantly confusing dry drowning with another terrifying term.
Secondary drowning.
Yes. Secondary drowning. People use them interchangeably in comment sections all the time. But based on the sources, the biology of what is happening inside the dog's chest is entirely different.
Radically different.
With dry drowning, the water never really makes it past that locked bouncer. But with secondary drowning, the water actually breaches the defenses and gets into the deep lung tissue.
The distinction is vital because it changes the pathological timeline. You just outlined the dry drowning mechanism perfectly. It's a mechanical airway blockage at the throat.
Right.
Secondary drowning, on the other hand, is an insidious, slow-moving inflammatory crisis deep inside the chest. If a dog inhales a larger amount of water and it bypasses the larynx, it pulls in those delicate lung sacs.
And that causes problems with the surfactant, right?
Exactly. The lungs contain a highly specialized soapy substance called surfactant. Surfactant lowers surface tension and keeps the tiny air sacs open so they can inflate and deflate easily.
So when the lake water or pool water gets in there, it essentially washes away that vital grease. It strips the surfactant right out of the lungs.
It strips it away completely, and without surfactant, the air sacs collapse like wet tissue paper. Furthermore, the body recognizes this foreign water, especially if it's chlorinated pool water or bacteria-filled lake water, as a massive insult.
So the immune system freaks out.
It completely overreacts. It sends a flood of fluid and white blood cells to the area to fight the irritation, so the dog actually begins to drown internally in their own inflammatory fluids.
Wow.
That internal flooding is secondary drowning, and the terrifying part is that this fluid buildup can take 24 to 48 hours to reach a critical mass.
Okay, wait, let me push back on this a bit. Because if both conditions require rushing the dog to the emergency vet, and both can easily be fatal if ignored, does knowing the biological difference actually matter for a panicked owner in the moment?
That's a fair question.
Right. If my dog is struggling to breathe, do I really care if it's a laryngeal spasm versus strip surfactant?
From a pure triage perspective of, do I go to the vet? No. You go immediately regardless. But from an observational perspective, knowing the difference dictates exactly what you are looking for in the hours after the swim.
Okay.
Dry drowning, because it's a muscle spasm in the throat, tends to manifest as an acute, sudden struggle to pull air in. You're going to hear the noise of a blocked pipe.
Got it.
Secondary drowning is a slow burn. You might not see a sudden gasping fit. Instead, you'll see a dog slowly getting more lethargic, their breathing getting slightly faster, slightly shallower over an entire day as their lungs quietly fill with fluid.
That makes total sense. So understanding both mechanisms ensures you don't let your guard down just because the dog seems fine 10 minutes after leaving the beach. You're monitoring for two entirely different failure modes.
Exactly.
Let's dig deeper into the trigger for that laryngeal spasm, the dry drowning catalyst. Because the source text notes that in about 10% of all near drowning or water inhalation incidents, this specific contact with the larynx triggers the spasm.
10%.
Which is a massive, highly concerning statistic when you think about how many dogs go swimming every weekend.
It is a really significant statistical risk. And what makes that 10% so dangerous is the lethal feedback loop it creates.
Because of the oxygen drop.
Right. The initial spasm restricts the airflow, which immediately causes the dog's blood oxygen levels to drop.
And the second the brain registers a drop in oxygen, the dog panics.
Panic is the accelerant. I mean, the dog gets scared because they can't pull a full breath. When they panic, their heart rate spikes, adrenaline floods their system, and their body's demand for oxygen just skyrockets.
So they need more air, but the door is locked.
Exactly. The brain screams at the lungs to pull in more air. The dog tries to take a massive, forceful breath against a closed larynx, and that forceful suction actually irritates the vocal cords further, causing the spasm to tighten even more.
Oh, wow.
It is a self-feeding cycle of suffocation. The harder they try to breathe, the tighter the throat locks. This terrifying physiological standoff can last for minutes.
So the body's own defense mechanism essentially weaponizes itself against the dog.
Unintentionally, but yes.
So if 10% of these water inhalation events trigger this security lockdown, what is the actual prevalence? Is this happening constantly at every local dog beach? Like, is dry drowning considered a common occurrence? Or are we dealing with a statistical rarity?
In the broader scope of veterinary medicine, dry drowning is officially classified as a rare event. However, and this is a big however, it is deeply recognized by emergency specialists as a low probability, high consequence risk.
High consequence meaning fatal.
Yes, and the historical data on this is actually quite fascinating. Recent advancements in veterinary pathology have revealed that many historical cases from the 80s and 90s that were labeled as dry drowning were likely misdiagnosed.
Really? What were they actually looking at if it wasn't a spasm?
Pathologists performing necropsies found that in a significant number of cases where a dog suddenly died in the water without fluid in their lungs, the dog had actually suffered a massive pre-existing medical event.
Like what?
They found hidden congenital heart defects that triggered sudden cardiac arrest. They found sudden blood clots or even spinal trauma from diving into shallow water.
Oh, I see.
The dog suffered a fatal event that caused them to stop breathing the millisecond they hit the water, or just before.
So the water was just the location of the tragedy, not the physiological cause. The dog had a heart attack while swimming, they sank, they didn't inhale water because their heart had already stopped, and vets mistakenly called it dry drowning.
Precisely. That historical misclassification inflated the numbers in the past. But stripping those cases away doesn't eliminate the condition entirely. Dry drowning absolutely still exists as a distinct fatal mechanism.
Right, because thousands of pets tragically drown in residential pools and natural bodies of water every single year in this country.
And dry drowning accounts for a very specific, highly dangerous subset of those statistics. It is rare, but the consequences of ignoring it are absolute.
And because it's rare, but undeniably deadly, relying on luck simply isn't a viable strategy for an owner. You can't just cross your fingers and hope your dog isn't in that percentage.
Definitely not.
Spotting the early, incredibly subtle physiological changes is the only way to beat the odds. I want to spend a lot of time on this next area because this is where owners can literally save a life. What are the definitive warning signs of dry drowning?
The overarching theme of the symptoms is deception. The presentation is incredibly deceptive. You have to imagine the scenario: your dog jumps out of the pool, they do the classic full-body shake, spraying water everywhere.
They seem totally fine.
They trot over, grab a toy, maybe eat a treat you offer them. To the naked eye, their systems are functioning perfectly. But beneath the surface, the laryngeal tissue has been insulted. Hours later, the microscopic swelling begins, or the delayed spasm kicks in.
And what does that delayed manifestation actually look like in the living room?
It manifests as a constellation of respiratory and neurological distress signals. Persistent, unyielding coughing or hacking is usually the first overt sign.
Okay, coughing.
You will also see marked trouble breathing, like unusual, shallow, rabid panting, even in a cool, air-conditioned room. You will see a dog that was energetic 2 hours ago suddenly exhibiting profound lethargy and weakness.
Just totally crashing.
Right. They might vomit as their gag reflex is triggered by the throat irritation. You need to check their gums for paleness. And critically, you will see behavioral changes driven by a lack of oxygen-intense anxiety, pacing, and restlessness.
It's so important to harp on this because it's easily misinterpreted. It's like lighting a really long invisible fuse. You're driving home, listening to the radio, totally unaware the fuse is burning down in the back seat.
That's exactly what it's like.
And when the symptoms do start, if an owner hasn't established a physiological baseline for their dog, they're going to completely miss the subtle deviations. If you don't know what your dog's chest looks like when they are fast asleep on the rug, or how many breaths they take a minute at rest, you won't realize they are breathing 20% faster than normal until it's a full-blown crisis.
Establishing a baseline is the single most proactive thing a pet owner can do. Count their breaths per minute while they sleep. Lift their lip and look at the healthy pink color of their gums on a normal Tuesday. Memorize that color.
Because things can change fast.
Fast! Because among all the warning signs we just listed, the one that usually prompts an owner to finally look up from their book is the coughing. But it is not a standard run-of-the-mill throat clear.
Right. Let's break down the cough. Because if I drink a glass of water too fast, it goes down the wrong pipe. I cough 3 or 4 times, my eyes water, and I'm fine. A dog clearing a few stray droplets of lake water is normal. So what does the specific coughing associated with dry drowning tell you? How do we differentiate the benign hack from the fatal spasm?
The differentiation lies in the acoustics, the duration, and the physical output. A normal, productive cough to clear droplet is brief. It happens a few times right as they exit the water, and it resolves entirely.
Okay, so it stopped.
Yes. The dry, drowning cough is a crisis response. It is persistent, and it often begins or continues long after the dog has left the water environment. Acoustically, it will sound distinctly harsh. Some vets describe it as a goose honk sound.
Wait, a goose honk. Why does it sound like a goose?
Because the airway is physically narrowed by the swelling and the spasm. You are forcing the same volume of air through a much tighter, irritated tube. It physically changes the resonance of the cough. Furthermore, you are looking for the presence of foamy saliva.
Yeah, I saw that in the source text, and it deeply unsettled me. Foamy saliva coming out of the mouth while they cough. Where's the foam coming from?
It's simple fluid dynamics. The dog has trapped mucus and tiny amounts of fluid in a highly restricted, spasming airway. The lungs are forcefully pushing air past that fluid at high velocity as the dog tries to clear the blockage.
So it's basically whipping the saliva up.
Exactly. That high-velocity air whips the mucus and saliva into a thick foam. If your dog is having a coughing fit accompanied by foam, or if they have a harsh, unyielding hack that repeats every few minutes while they're just sitting on the couch, their body is actively failing to clear an obstruction.
And as that persistent coughing fails, the mechanical strain of trying to suck air through a straw begins to visibly alter the dog's physical state. The lack of oxygen strains the entire system. Let's talk about the breathing changes. How does the physical act of respiration change as this condition escalates?
The escalation is rapid and visually alarming. The dog will begin to breathe significantly faster to compensate for the fact that each breath is bringing in a lower volume of oxygen. They will pant heavily while completely at rest.
Even if it's cold?
Right. You might hear audible wheezing or just a noisy, raspy stridor with every inhalation, and in severe progressing cases, you will witness cyanosis.
Cyanosis is the bluing of the tissues, right? Like the oxygen starvation in the blood becomes visible.
Exactly. The gums, the tongue, and the mucous membranes inside the mouth will turn pale, stark white, or a distinct bluish purple. But even before the color changes, the physical mechanics of breathing will shift from passive to labored.
Wait, I want to explore this because this is where I think owners get tripped up.
Yeah.
Swimming is an exhausting full-body workout. Like my Labrador retrieved a bumper from the lake for 20 minutes and he pants like a freight train for an hour afterward. He's just exhausted. How am I supposed to differentiate between a dog who is just thermal panting from exercise and a dog who is oxygen-starved and experiencing labored breathing? They both look like heavy breathing.
It is a critical distinction, and it comes down to the anatomical mechanics of how they are drawing the air. When a dog pants to cool down from exercise, which is thermal panting, it is generally an open-mouth, rapid but shallow exchange of air.
Right, their tongue is hanging out.
Yes. They are moving air quickly back and forth over their wet tongue and upper airway to evaporate moisture and release body heat. The chest movement is fast, but it looks relatively relaxed. They aren't struggling, they're just ventilating.
Okay, so what does labored breathing look like?
Labored breathing, which indicates an airway obstruction or lung failure, is a violent whole-body struggle.
So you're looking past the mouth and looking at the body itself.
You look directly at their abdomen and their posture. When the airway is locked in a spasm, the diaphragm alone isn't strong enough to pull the air in. The dog's brain forces the recruitment of accessory abdominal muscles.
So their stomach gets involved.
Heavily involved. You will see their stomach heaving forcefully inward and outward with every single agonizing breath. You will also often see them adopt an orthopneic posture.
What's orthopneic posture?
They will stand up, refuse to lie down, extend their necks straight out, and pull their elbows wide apart away from their rib cage.
Wow. They are literally trying to stretch their chest cavity as wide as biologically possible to create a vacuum.
Yes. They are physically maximizing the space in their thorax to fight the resistance in their throat. If your dog is exhibiting heavy abdominal heaving and standing with their elbows locked wide, that is not thermal panting. That is a dog fighting a losing battle against asphyxiation.
That mental image is terrifying. And that physical struggle to pull in air inevitably forces a massive neurological shift, too. It's not just a physical failure. The brain is getting starved of its primary fuel.
Which causes major behavioral changes.
Right, behavioral changes that owners constantly misinterpret. What do those behavioral shifts look like?
Well, hypoxia, which is the medical term for tissues being deprived of adequate oxygen, wreaks havoc on brain chemistry. A dog experiencing early-stage hypoxia might initially crash into extreme lethargy.
It was wiped out.
Profoundly weak. They refuse to move. They won't even look at a high-value treat. But as the oxygen deprivation deepens, it triggers the central nervous system's panic response. The dog will experience intense, unexplainable anxiety.
So instead of passing out, they actually get hyperactive and restless.
Yes, and this is the tragedy of the misinterpretation. The dog will constantly pace the room. They will repeatedly lie down, immediately stand back up, whine, look at their sides, and pace some more.
Because they don't know what's happening.
They just feel an overwhelming sense of doom and physical distress, but they have no way to communicate that their airway is closing. Many owners see a pacing, whining dog that occasionally vomits, because hypoxia also triggers nausea, and they logically assume the dog swallowed a bad stick or has a mild stomachache from lake water.
They think it's a GI issue. So they tell the dog to go lie down on their bed and sleep it off. And because the owner assumes it's just a tummy ache, they turn off the lights and go to sleep themselves.
And that's when tragedy strikes.
That is heartbreaking. It proves how vital it is to combine the symptoms, the pacing plus the harsh cough plus the abdominal breathing. You have to put the puzzle pieces together.
Yeah.
But the most psychologically taxing part for the owner, once they know the puzzle, is how long they have to watch the board. Let's talk about the timeline. What is the actual timeline for dry drowning in dogs?
The timeline is what elevates this from an accident to a lingering nightmare. The onset of symptoms can range anywhere from mere minutes after leaving the water environment to several hours later, and in some documented cases, up to a full 24 hours post-exposure.
A 24 to 48-hour window of vigilance. That is a massive operational window for an owner.
It requires a lot of stamina.
Right. If I take my dog to the beach on a Saturday morning for a quick hour of swimming, the literature is telling me I have to remain on high alert, monitoring their respiratory rate and gum color until Monday morning.
It is an incredibly difficult reality to accept, but medically, yes. The delayed onset is what kills. A dog can have a steep, sudden decline from seemingly perfect health a whole day later. The inflammatory cascade and the potential for a delayed laryngeal spasm triggered by microscopic tissue swelling are wildly unpredictable.
Let's break down that daunting window chronologically. How soon after swimming can the absolute earliest signs of dry drowning happen?
The absolute earliest is immediate. It can happen poolside.
Just instantly.
Yeah. The dog inhales a splash of water. The larynx violently spasms on contact, the airway locks 100%, and the dog collapses right there on the concrete. But more often than not, it is a delayed response. The initial irritation happens, but the full spasm or critical swelling holds off for 1 to 3 hours.
Why the delay? Is there a specific trigger that suddenly activates it 3 hours later?
Yeah.
Do they fall asleep and their breathing rhythm changes, dropping their oxygen? Or is it just a slow, invisible snowball rolling down a hill?
It is very much the snowball effect. Think of the laryngeal tissue like a highly sensitive mucous membrane. A tiny bit of chlorinated water or bacterial lake water hits it. It causes a microscopic chemical or physical insult.
Okay, an insult.
The body sends fluid to heal that insult, causing slight swelling. As the tissue swells even a millimeter, it narrows the diameter of the windpipe.
And when you force the same amount of air through a narrower pipe, the air has to move faster.
Exactly. It creates turbulent airflow. That fast, turbulent air physically irritates the swollen tissue even more, drying it out and causing microabrasions. That causes more swelling, which causes more turbulent air.
So it just feeds itself.
It is a slow, self-amplifying cycle that builds over hours until it finally crosses a critical threshold into a full-blown spasm or a total physical blockage.
Given this erratic, snowballing timeline, how exactly does an owner manage this watch period? The guide says to watch them, but practically speaking, how long should you watch, and what are you actively doing during that time?
The strict veterinary protocol is 24 to 48 hours of active monitoring. During this window, you are playing the role of an off-duty lifeguard inside your own house.
Just constantly observing.
You are actively listening for that harsh goose honk cough. You are watching their chest to ensure they aren't recruiting their abdominal muscles to breathe. You are monitoring their energy levels for unexplained lethargy or panicked pacing. And crucially, you need to be regularly checking their capillary refill time.
Let's explain how to actually perform that check, because just looking at a dog's mouth isn't enough. How do you properly check capillary refill on a dog's gums?
It's a very simple but vital diagnostic test you can do in your living room. You gently lift the dog's upper lip to expose the gums above the canine tooth. You want to find a spot that is naturally pigmented. Pink. Some dogs have black mottling, so find a pink area.
Okay, find the pink spot.
Then you press your thumb or index finger firmly against that pink gum tissue for about 2 seconds. You apply enough pressure to physically push the blood out of the capillaries, and then you quickly release your finger.
And it leaves a stark white fingerprint on the gum where you pressed.
Yes. The moment you release, you count how many seconds it takes for that white spot to refill with blood and return to its normal pink color. In a healthy dog with proper cardiovascular and respiratory function, that pink color should rush back in under 2 seconds.
Almost immediately.
Right, almost instantly. If it takes 3, 4, or 5 seconds for the pink to return, or if the gums are pale, white, gray, or blue to begin with, you have a massive problem. The blood is lacking oxygen, or the dog is going into systemic shock.
And within that 48-hour watch, there is an unavoidable tipping point. Let's say you're doing the checks, and suddenly you notice the breathing getting worse. When do most cases of dry drowning transition from just concerning to critically life-threatening?
The terrifying truth is that while the onset of the symptoms might be delayed for a day, once those symptoms actually manifest, the window to act shrinks from hours to mere minutes.
Minutes? That's terrifying.
It is. Cases usually become critical within the first hour or two of the first noticeable symptom. The progression of an airway block is violently fast. A persistent wet cough turns into severe abdominal labored breathing in 20 minutes. Panicked pacing turns into total physical collapse shortly after.
If I check the gums and see cyanosis, that blue or grayish-purple color, is it essentially already over? Has the brain been starved for too long, or is there still a microscopic window to save them if I break every speed limit getting to the clinic?
Cyanosis means you are dealing with profound systemic oxygen starvation. It indicates that cellular damage is actively occurring, particularly in the highly sensitive tissues of the brain and heart.
So it's catastrophic.
It is a catastrophic sign, but it is not necessarily an automatic death sentence if you are already in motion.
You
Have zero margin for error. The cascading failure of the respiratory system has reached its absolute tipping point. There is no home remedy. You put the dog in the back seat, you have someone else drive, and you secure their airway as best you can en route.
Well, what if you don't even make it to the car? What if the spasm happens poolside, or the dog collapses in the living room while you're getting your keys? You suddenly become the ultimate solitary first responder. Let's walk through the exact protocols outlined in the Doggozila Guide. What first aid should you give to your dog for dry drowning before you reach professional help?
Your immediate goal is anatomical positioning to maximize whatever tiny amount of airflow might still be possible. If they are in the water, haul them out immediately. Lay the dog on their side on a hard, flat surface.
Okay, flat surface.
You need to physically extend their head and neck completely straight out. Think of the airway like a kinked garden hose. You want to pull the head forward to eliminate any bends in the trachea, creating a straight, linear path for air.
The guide also mentions positioning the head lower than the body. How do you do that safely without curling their neck?
You can place a folded towel or a firm pillow under their hips and chest, elevating their hind end slightly so gravity can assist. If there is any fluid, vomit, or foam in the upper airway or mouth, gravity will help pull it out of the throat and onto the ground, preventing them from aspirating it back down.
Makes sense. Let gravity do the work.
Once they are positioned, you must open their mouth and gently pull their tongue straight forward.
Wait, why pull the tongue? Dogs have incredibly long, heavy tongues. Does it fall back and block the throat like in humans?
Exactly. When a dog loses consciousness or goes into severe respiratory distress, the muscle tone of the tongue flaccidly collapses backward, physically plugging the back of the throat. By pulling it forward and letting it hang out the side of the mouth, you clear a massive physical hurdle.
That's a crucial step.
It is. And once the airway is as straight and clear as you can manually make it, you can apply gentle, sweeping pressure on their chest and stomach.
I want to be really clear about this pressure.
Yeah.
Because doing chest compressions on a dog that has a heartbeat but just can't breathe sounds dangerous. How hard are you pressing? You don't want to break ribs on a panicking dog.
It is a sweeping motion, not a CPR compression. You use the flat of your palms and press firmly but gently, starting from the ribs, sweeping upward toward the neck. You are trying to assist the mechanical expulsion of any trapped air, fluid, or foam in the upper tract.
Okay, so it's a sweep.
But there is a massive caveat here, and it is a matter of human safety. A panicking, oxygen-starved dog is operating purely on reptilian survival instinct. They are blind with terror. You must be incredibly cautious to avoid getting bitten.
Even your own dog.
Even the most gentle, loving family dog will bite down with bone-crushing force if you put your hands near their mouth while they are suffocating.
Survival instinct overrides all training. You have to secure the airway, but you can't lose a finger doing it. And once you've done this positioning, you wrap them in a blanket.
Yes. Hypoxia and shock will cause the dog's core body temperature to plummet rapidly. Wrap them tightly in a blanket to preserve body heat and transport them immediately. Even if they cough up some foam, take a deep breath, and suddenly stand up looking fine, the trip to the vet is still mandatory.
because the microscopic damage is already done and the secondary swelling is coming. But let's assume the worst-case scenario. You pull them from the pool, you position the head, you pull the tongue, but they are completely unresponsive. Their chest isn't moving. You check the pulse on the inside of their hind leg, up high near the groin, and there is nothing. You have to escalate to full cardiopulmonary resuscitation. How do you perform CPR specifically for dry drowning in dogs?
Canine CPR is anatomically different from human CPR, and knowing the mechanics is the only way it works. Once you confirm there is no pulse and no breath, lay the dog flat on their right side on a hard, unyielding surface. Do not do this on a soft mattress. The compressions won't work.
Right, needs to be firm.
You are going to perform chest compressions. Place the heel of one hand over the dog's heart and put your other hand on top of it.
Where exactly is the heart located in a dog's chest? I mean, they're shaped so differently than us.
The easiest way to find it in an emergency is to bend the dog's left front leg backward at the elbow. Where the point of the elbow naturally touches the rib cage on the left side, that is directly over the heart.
Oh, that's a great landmark to remember.
Lock your elbows and press down, compressing the chest by about 1/3 to 1/2 of its total width. You need to deliver 30 rapid compressions. The tempo should be fast, about 100 to 120 compressions per minute, or roughly 2 compressions every second.
So it's 30 rapid, deep compressions. And then you have to deliver oxygen. This is where canine CPR drastically diverges from what we see on television for humans. How do you perform rescue breaths on a dog?
You must perform mouth-to-snout ventilation. You cannot do mouth-to-mouth on a dog.
Why? Because their mouths are too big.
It's the anatomical structure of the jowls and the jawline. A dog's mouth is elongated and has deep, loose flews on the sides. It is physically impossible for a human mouth to create an airtight seal over a dog's mouth. If you try to blow air into their mouth, 90% of it will instantly escape out the sides of their lips, and nothing will reach the lungs.
So what do you do?
Instead, you must use both of your hands to tightly wrap and clamp the dog's muzzle completely shut. Seal their lips together securely. Then you place your mouth entirely over both of their nostrils and blow forcefully into the nose.
You are using their nasal passages as a direct sealed tube to the trachea. That's wild.
Exactly. The nasal cavity connects directly to the windpipe. By clamping the mouth shut, you create a closed, pressurized system. You blow into the nostrils until you see the dog's chest physically rise, indicating the air bypassed the spasm and entered the lungs.
And how many breaths?
You deliver 2 solid rescue breaths after every 30 compressions. 30 compressions, 2 breaths. You do not stop this cycle until the dog begins breathing on their own or until you literally carry them through the doors of the veterinary emergency room.
Knowing these incredibly specific mechanical steps is vital. But under extreme, terrifying pressure, people often default to panic-driven reactions they've seen in movies. Knowing what not to do is arguably just as life-saving as knowing what to do. The guide is very explicit about this. What should an owner absolutely not do during a dry drowning event?
We have to dispel some incredibly dangerous myths right now. The absolute biggest rule: under no circumstances should you ever attempt the Heimlich maneuver on a dog you suspect of dry drowning.
Because panic makes us do crazy things, a lot of people instinctively try to perform the Heimlich when they see a dog choking, figuring they were choking on water. I was reading the literature on this, and doing the Heimlich in this specific scenario is basically signing the dog's death warrant.
Okay.
Why is that so catastrophic?
Think about the physics and the chemistry of what is happening. If a dog has been struggling in the water, they haven't just inhaled a drop of water, they have swallowed massive amounts of it into their stomach.
Oh, I see where this is going.
Their stomach is stretched tight, full of pool water mixed with highly acidic gastric juices. If you grab the dog and perform a violent Heimlich thrust to their abdomen, you will forcefully eject that massive volume of acidic stomach contents straight up the esophagus.
And because the dog is actively gasping for air and panicking?
They will immediately inhale that vomit directly through the vocal cords and deep into the lungs. The pH of stomach acid is incredibly low. It is highly corrosive. When that acid hits the delicate lung tissue, it causes immediate massive tissue liquefaction and chemical pneumonitis.
That is just horrifying.
You have just taken a temporary manageable laryngeal spasm and turned it into a catastrophic, highly fatal chemical destruction of the lungs. Do not do the Heimlich.
That makes perfect anatomical sense, even if it's terrifying. What about the other classic cartoon trope we see? holding the victim upside down by their ankles to shake the water out of their lungs.
It is entirely ineffective and wildly dangerous. First of all, as we established, in dry drowning, there is very little water in the lungs to begin with. You are trying to drain an empty container.
Right. Secondly, holding a panicking 80-pound Labrador upside down by their hind legs is physically impossible for most people, and the physical struggle will massively increase the dog's oxygen demand and stress levels.
Not to mention the stomach issue again.
Yes, hanging them upside down also eliminates the effect of gravity on the stomach sphincter, basically inviting the stomach contents to slide down the esophagus and be aspirated. You keep them flat on their side.
The ultimate do not, however, revolves around the decision to seek professional help. We touched on this, but what is the exact uncompromisable trigger for putting the dog in the car? When should you take your dog to the vet?
You transport the dog immediately upon noticing any of the symptoms we've discussed. You do not wait to see if the cough improves. You do not give it an hour to see if the lethargy lifts.
Go right away.
The moment you recognize the harsh cough, the labored breathing, or the pale gums, you load them in the car. Ideally, you have someone else call ahead to the emergency clinic while you are driving, so the veterinary team can prep an oxygen station and have a triage nurse waiting at the door. I want to push back on this slightly, just to play out a very common scenario. Let's say I'm at the lake. My dog inhales water, has a coughing fit, drops to the ground, and seems to be suffocating. I do the first aid, I extend the neck, I pull the tongue, I do a chest sweep. Suddenly, the dog coughs up a huge glob of foam, takes a massive deep breath, stands up, shakes off, wags their tail, and goes to grab a stick.
A miraculous recovery.
Exactly. They look 100% fine. They are breathing normally. In that moment, a massive emergency vet bill feels like an overreaction. Do I really still have to go?
You absolutely unequivocally still have to go. The recovery you just described is wonderful, but it is superficial. You have to understand the microscopic physiological damage that just occurred. The laryngeal tissues were severely insulted and bruised.
Even if they're acting normal.
Yes, the violent negative pressure the dog created in their chest while trying to breathe against a closed airway likely caused microscopic tears in the lung capillaries. Over the next few hours, fluid is going to leak from those torn capillaries into the lungs, a condition called non-cardiogenic pulmonary edema.
So it's happening inside, where you can't see it.
You cannot see that edema happening from the outside until the dog is drowning in it. The vet visit is non-negotiable because your house does not have the tools to stop the invisible cascade.
Which perfectly transitions us to the medical intervention. You speed to the clinic, you burst through the doors, and hand the leash to the triage nurse. How do veterinarians actually treat dry drowning in dogs once they take over? What is their immediate priority?
The absolute singular priority the moment that dog crosses the threshold is restoring blood oxygen levels and breaking the panic cycle. The body's crashing systems must be stabilized. Oxygen therapy is the cornerstone of everything they do.
So they just pump oxygen.
If the dog is conscious but struggling, they will immediately administer flow by oxygen, holding a tube near the nose, or strapping an oxygen mask over the muzzle to flood the inhaled air with pure O2.
But earlier we discussed how a dog fighting for breath is panicking and thrashing. How does a vet team even manage to keep a terrified, oxygen-starved dog still enough to strap a mask to their face, shave a leg for an IV, or position them for chest x-rays?
It requires a highly skilled, delicate balance of pharmacological intervention. The vets must rapidly administer intravenous medical sedation. They use specific drugs that calm the brain, stop the violent thrashing, and break the sheer terror the dog is experiencing.
To lower their oxygen demand.
Exactly. This is crucial because a calm dog requires significantly less oxygen than a thrashing dog. But it's a tightrope walk. They have to dose the sedation perfectly. If they give too much, they suppress the dog's innate respiratory drive, the primal instinct in the brainstem that commands the diaphragm to pump. They need the dog calm, but they need the dog actively trying to breathe.
And if the spasm is completely locked, and the dog simply cannot pull air past the larynx no matter how much oxygen you blow at their face,
then they move to immediate intubation. Under heavy sedation or brief anesthesia, the vet will use a laryngoscope to physically visualize the locked vocal cords, pass a rigid endotracheal tube directly through the spasm, effectively forcing the airway open, and connect the dog to a mechanical ventilator that will breathe for them until the swelling subsides.
You mentioned the vet has an entire arsenal of oxygen delivery systems. Let's look closer at those, because the source text mentions some incredible technology. What specific oxygen therapies are used for dry drowning?
We scale up based on the severity of the crisis. We start with the masks and the nasal cannula small tubes inserted directly into the nostrils. If the dog won't tolerate a mask, they will place them in an oxygen cage.
What does that look like?
This is a sealed, temperature-controlled, clear acrylic enclosure that is pumped full of a highly concentrated oxygen mixture. The dog can rest comfortably inside without anything touching their face, breathing air that is 40 to 60% oxygen compared to the 21% in normal room air.
But the guide also mentions something called hyperbaric oxygen therapy. From reading the literature, this blew my mind. They are using the exact same hyperbaric chambers that deep-sea scuba divers use to treat the bends, but for dogs who choked on a pool toy. How does that work?
It relies entirely on the physics of gas exchange, specifically Henry's law. In a normal environment, oxygen relies on red blood cells to carry it through the body. But in a hyperbaric chamber, the dog is sealed inside and the atmospheric pressure is vastly increased.
Like deep underwater pressure.
Yes, sometimes up to 2 or 3 times normal sea level pressure while flooding the chamber with 100% pure oxygen.
And what does that physical pressure do to the oxygen?
The extreme pressure physically forces massive amounts of oxygen gas to dissolve directly into the dog's blood plasma, entirely bypassing the need for red blood cells or perfectly functioning lung alveoli to do the heavy lifting. The plasma itself becomes supersaturated with oxygen.
Wow, so it circumvents the lungs almost entirely.
It allows oxygen to reach deeply starved tissues, especially brain tissue, at an exponentially faster rate than normal breathing. It is a game changer for severe hypoxic events.
While pumping them full of oxygen keeps the brain alive in the moment, it doesn't fix the underlying structural damage done to the throat and the lungs. You have to heal the tissue. What medications help with dry drowning?
It requires a multi-pronged, highly aggressive pharmacological approach. It's essentially a chess match against the dog's own failing biology. First, they deploy diuretics, usually intravenously. Diuretics forcefully stimulate the kidneys to pull excess water out of the blood and tissues.
To deal with the fluid in the lungs.
Right, which rapidly reduces any pulmonary edema that occurred from the vacuum pressure.
So diuretics act like the chemical sump pump, sweeping the internal water out.
Exactly. Then they administer powerful systemic anti-inflammatories, almost always heavy corticosteroids. These drugs rapidly shut down the body's immune overreaction, forcefully reducing the life-threatening swelling in the laryngeal tissue and the vocal cords.
To open the pipe back up.
Next, they may use bronchodilators. These drugs act on the smooth muscle lining the lower airways, chemically forcing the bronchial tubes to relax and dilate, kicking the doors wide open to maximize whatever airflow is getting past the larynx.
So you have the sump pump sweeping out the fluid, the steroids shrinking the swollen throat, and the dilators forcing the lower pipes open.
Yeah.
But there's a fourth branch to this tactical team, right? The antibiotics. Why pump a dog full of antibiotics for a mechanical throat spasm?
Because the secondary threat of infection is astronomical. Any water inhaled from a swimming pool, a murky lake, or even a backyard puddle is teeming with bacteria, chemicals, and microscopic organic matter.
Just a soup of bad stuff.
If even a microscopic drop of that contaminated water made it past the larynx during the struggle, it provides a perfect breeding ground inside the warm, dark, damaged environment of the lungs. The risk of a massive secondary aspiration pneumonia appearing 3 days later is huge.
So they preemptively strike.
Exactly. Broad-spectrum antibiotics are deployed preemptively to stand guard and kill those bacterial invaders before they can multiply. Finally, the team will constantly adjust intravenous electrolyte solutions to restore the cellular chemical balance that was wrecked during the panic and shock.
With all of these incredibly aggressive medical interventions, the hyperbaric chambers, the mechanical ventilators, the tactical cocktail of steroids and antibiotics, what are the actual statistical odds that your dog pulls through? What is the real-world prognosis for dry drowning?
The prognosis is highly variable, but it hinges almost entirely on one single factor, the speed of treatment. It is a brutal race against the clock. The faster oxygen levels are restored to the blood, the exponentially better the chance of a full recovery. If you get the dog to the clinic at the first sign of a harsh cough, the prognosis is excellent.
But if you wait until they collapse?
Then the odds drop precipitously. Several other factors play a role, of course. The dog's overall baseline health, their age. A resilient 1-year-old dog can bounce back from tissue hypoxia much better than a 14-year-old dog with a weak heart and any pre-existing respiratory conditions.
Right, the baseline matters.
But the ultimate unforgiving ticking clock in the prognosis is the sheer length of time the dog was deprived of oxygen.
Because the brain starts dying?
Yes. The brain's extreme sensitivity to hypoxia is the deciding factor in whether the dog truly recovers. Muscle tissue and even lung tissue can survive for a shocking amount of time without fresh oxygen, but brain cells begin to suffer irreversible damage and die within minutes of severe oxygen deprivation.
That's sobering.
Prompt treatment often yields a 100% full recovery, but if the oxygen starvation was too prolonged, the vet might successfully heal the lungs and fix the larynx, but the dog could still be left with permanent, severe neurological deficits, blindness, or motor function loss due to brain damage.
Theory, statistics, and medical pharmacology are incredibly important to understand, but to truly grasp the gravity and the stakes of this condition, we need to look at how this plays out in the real world with real families. The source material highlights a couple of real-world scenarios. What real cases should every owner know about to internalize this threat?
The text outlines two very sobering, distinct cases that perfectly illustrate the spectrum of this phenomenon. Case 1 involves a severe, acute incident. A dog suffered an actual near-drowning event in a pool. The dog was pulled out, unresponsive.
A worst-case scenario.
The owner performed flawless textbook canine CPR on the pool deck, miraculously managed to revive the dog, and immediately transported them to the veterinary emergency room.
Which is incredible. The owner did exactly what they were supposed to do. They saved the dog's life. It wasn't over.
Far from it. Despite the CPR success, and despite the dog breathing on its own upon arrival at the clinic, the dog was quickly diagnosed with severe non-cardiogenic pulmonary edema, massive fluid leaking into the lungs due to the negative pressure trauma, as well as acute aspiration pneumonia from the pool water.
Oh, wow.
The dog required days of intensive care unit monitoring, oxygen therapy, and aggressive medications to survive the secondary complications of the initial spasm.
That case is terrifying precisely because the owner did everything perfectly, and they still ended up dealing with life-threatening complications. It proves that simply getting them to breathe again isn't the finish line. What about the second case?
Case 2 illustrates the deceptive, slow-burn nature of the condition. A dog was playing fetch at the beach in the ocean. The dog swallowed and inhaled a moderate amount of salt water during the play session. The dog didn't collapse. They seemed totally fine, rode home in the car, and ate dinner.
Just a normal beach day.
Right. But they coughed persistently all night long. The owner, thankfully, didn't ignore it. They took the dog in the next morning. The microscopic irritation from the salt had triggered severe inflammation, and the dog required extensive diagnostic evaluation and immediate treatment for early-stage chemical pneumonia to prevent the airway from fully compromising.
These cases prove that dry drowning and its related complications are not just internet fear-mongering or a myth cooked up on social media. It is a highly documented reality.
Yeah.
But as terrifying as it is also deeply preventable if you change how you interact with your dog around water.
Prevention is key.
So how do we bulletproof our beach days and our pool parties to ensure we never reach the emergency clinic? What are the best prevention tips?
Prevention requires a fundamental shift in how we view canine water play. It starts with strict, undivided, active supervision. You cannot treat the dog pool like a babysitter. You never scroll on your phone, read a book, or turn your back while your dog is actively swimming.
Eyes on them at all times.
Second, you must invest in a high-quality, properly fitted canine life jacket. This is non-negotiable for amateur swimmers, older dogs, or trips to the ocean where currents exist.
Even for dogs that are good swimmers. I think a lot of people assume labs and Goldens are born with gills and never need a life jacket.
Even Olympic swimmers can cramp, get exhausted, or inhale a wave. The life jacket keeps the dog's head elevated above the waterline horizontally, drastically reducing the chance of water splashing directly into the larynx. Furthermore, you must actively manage their playstyle.
Like telling them to calm down.
You need to limit them diving underwater to retrieve sunken toys, and you must actively discourage them from snapping at the water hose or gulping water while they paddle.
You also have to protect them from themselves, right? Dogs simply do not know when to quit. They will chase a ball into the lake until their heart gives out.
Absolutely. You must enforce mandatory, frequent rest breaks out of the water in the shade to prevent sheer physical exhaustion, because an exhausted dog swims lower in the water and pants heavier, inviting inhalation.
Good point.
If you have a puppy, you must introduce them to water slowly in very shallow environments so they don't experience a panic response. But critically, and this is a preventative step that almost everyone overlooks, if you have a backyard pool, you must explicitly train your dog where the pool steps are.
Why is step training so vital? Can't the dog just see the massive white plastic stairs in the shallow end?
When a dog is calm, yes. But if a dog accidentally falls into a pool unsupervised, or if they get suddenly exhausted in the deep end, sheer panic sets in instantly. When a dog panics in the water, their cognitive function plummets.
They just lose their minds.
They lose spatial awareness and complex problem-solving ability. They will completely forget where the stairs are located. Instead, their reptilian brain tells them to take the shortest path to solid ground, which means they will instinctively swim to the nearest vertical wall and frantically try to claw their way up the side.
And they can't climb a vertical pool wall, so they just thrash there until they sink.
Exactly. The thrashing leads to rapid exhaustion. Their head dips below the surface, they gasp, and they inhale water. You have to train them repeatedly, calmly, using high-value treats to swim to the stairs from every single angle in the pool over and over until finding the exit becomes ingrained muscle memory that overrides the panic response.
These preventative measures, the life jackets, the supervision, the step training, apply universally to every single dog. But anatomically speaking, some dogs are inherently walking a much tighter, more dangerous rope the second they get near a body of water. Which breeds are most at risk for dry drowning?
The absolute highest risk category belongs to the brachycephalic breeds. These are your flat-faced dogs, English bulldogs, French bulldogs, pugs, Boston terriers, and boxers.
Taking a bulldog swimming feels a bit like taking a vintage, incredibly heavy, low-clearance car and trying to drive it on a rugged, muddy dirt track. The car might be beautiful, but the machinery simply wasn't designed for that environment. You have to intimately know the engine's limits before you even attempt it, or you're going to completely flood the engine.
That is the perfect mechanical analogy. The anatomical challenges these brachycephalic dogs face in the water are immense and multi-layered. First, they have elongated soft palates that hang down in the back of their throat, incredibly narrow tracheas, and very restricted nasal openings.
So they're already compromised.
When they paddle hard and try to breathe heavily, the negative vacuum pressure they create trying to suck air through those tiny nostrils literally pulls that fleshy, soft palate down into the airway, partially blocking it before they even inhale water.
They were essentially choking on their own anatomy just by exercising.
Yes, and physically, their body mass distribution is entirely wrong for buoyancy. They are incredibly chest-heavy with massive shoulders and narrow, dense hips. They are physically dense. They sink like stones.
They have to work so hard.
They have to paddle exponentially harder than a Labrador just to keep their snout above water. That massive exertion, combined with the compromised airway, creates a perfect, deadly storm for water inhalation. Beyond the flat-faced breeds, puppies under 4 months old whose immune systems and reflexes are immature, senior dogs, and any dog with a history of seizures, neurological deficits, or heart conditions are highly vulnerable.
So for them, life jackets are mandatory.
For these specific demographics, a life jacket isn't just a recommendation, it is a mandatory piece of life support equipment, and their water sessions should be incredibly short and hyper-supervised.
Even if your dog isn't high risk, let's say you have a healthy, athletic adult dog, and even if they had a perfect, totally uneventful, joyous swim, the protocol after leaving the water must be strictly followed. You can't just toss them in the car. What should you do after every single swim to prevent dry drowning?
The post-swim routine must be viewed as just as important as the swim itself. The very first step, the moment they exit the lake or the pool for the final time, is to rinse them thoroughly with fresh, clean water from a hose or a shower. You must remove the chlorine, the salt, the algae, and the lake bacteria from their coat.
I understand washing them so they don't smell like a swamp, but why does the coat matter for a respiratory condition like drowning?
Because dogs groom themselves constantly. If they have harsh pool chemicals, dried salt, or bacterial lake scum drying on the fur around their muzzle, their nose, and their paws, they are going to lick it.
Oh, that makes sense.
They can easily inhale those dried chemical irritants later that evening while grooming, which can irritate the larynx and trigger a delayed spasm hours after they left the pool. After rinsing them with fresh water, you must dry them thoroughly with a towel, paying special attention to the head, face, and ears.
And then wash them.
And then, as we've hammered home, you institute that mandatory 24 to 48-hour watch period. You monitor the baseline, you watch for the persistent coughing, the abdominal breathing changes, the anxious pacing, and you routinely check the capillary refill time on their gums.
To bring this massive, comprehensive deep dive to a close, I want to rapid fire through the most common, lingering questions owners still have, consolidating all the knowledge we've unpacked today. The guide provides a great FAQ wrap-up. Let's hit the first major question. Can dry drowning in dogs happen after a bath?
Yes, absolutely. If water is inhaled, regardless of the source, the laryngeal mechanism can trigger. You must always actively supervise bath time and be incredibly careful to keep the showerhead spray or deep bath water away from their face and nose.
What blows my mind here is that this isn't just a dramatic beach or swimming pool problem. Because the larynx acts on a strict, unthinking biological reflex, my dog could technically suffer this terrifying cascade just from slipping in the bathtub or taking a splash of soapy water straight to the snout.
Exactly right.
The larynx doesn't care if the water came from a pristine mountain stream, a heavily chlorinated municipal pool, or your bathroom showerhead. The reflex acts identically to the physical presence of the fluid. Next question. What is the exact timeline again?
The onset of symptoms can strike anywhere from immediate minutes to a full 24 hours post-exposure. You must maintain vigilant monitoring for 24 to 48 hours.
Let's reiterate the difference between secondary versus dry drowning one more time for absolute clarity.
Dry drowning is an acute mechanical muscle spasm blocking the throat airway. Very little to no water actually reaches the deep lungs. Secondary drowning is a massive influx of fluid and inflammation deep inside the lung tissue occurring hours or days later due to strip surfactant.
What exactly should you do if you suspect it's happening right in front of you?
Remove the dog from the water environment instantly. Position them flat on their side with the head and neck fully extended straight to open the physical airway. Pull the tongue forward. Perform canine CPR 30 compressions to 2 nasal breaths if there's absolutely no pulse or respiration. Wrap them in a warm blanket to fight shock and get to the nearest emergency veterinary clinic immediately. Do not attempt the Heimlich.
Can they truly fully recover from this?
Yes, they absolutely can. But survival and full recovery are entirely dependent on prompt, aggressive, professional veterinary treatment and oxygen therapy.
And finally, how do we prevent it in the first place?
Undivided, phone-free supervision. Mandatory life jackets for vulnerable breeds. Limit diving and water gulping. Enforce frequent physical rest breaks. Rinse them with fresh water post-swim, and monitor their baseline vitals closely after every single water activity.
Is it common?
Statistically, it is rare, but it is a highly recognized, deeply fatal risk that requires absolute owner awareness.
Incredible.
And, as we wrap up today's deep dive, I want to leave you with a philosophical medical observation to chew on regarding everything we've discussed. The mammalian body's evolutionary mechanisms are undeniably incredible. They have been shaped and honed by millions of years of brutal survival.
The bouncer doing its job.
Right. The fact that the larynx knows to snap shut the microsecond water touches it is a miracle of biology designed to keep the lungs pristine. But dry drowning perfectly, tragically illustrates how a rigid reflex meant to save us can sometimes become the exact mechanism that destroys us.
A fatal paradox.
When the body prioritizes a localized defense over the systemic need for oxygen, it creates a fatal paradox. It really makes you wonder what other deeply ingrained primal protective instincts in our pets, or even in our own human bodies, might actually be outdated software reflexes that are desperately in need of a modern conscious override to prevent us from hurting ourselves in our attempt to survive.
Thank you for listening, dear Brigadiers. And if you have any questions, visit the source article on Doggozila Magazine at doggozila.com.
Stay safe out there, everyone.
That was all for this episode. And until the next time, bye to all listeners of the Bark Brigade podcast.